Hi, this is Ryan Kelly with the Journal of Emergency Medical Services, and I'm here with Jonathan Washko, who is one of the EMS10 Innovators in EMS Award winners for 2016. Hi, Jonathan.
Hi, Ryan. How are you?
Good to see you again.
Great to be here. Thanks.
So, Jonathan, you are winning this award for your work being instrumental, really, in the development of New York's largest community paramedicine and mobile integrated healthcare program. Can you tell us a little bit more about that?
Yeah, thanks. Well, it's a project we've been working on since 2013, and it's a collaboration between many different service lines within the Northwell Health organization. It's ourself with the Center for Emergency Medical Services, a group known as House Calls, who's a group of physicians that go into patients' home to take care of frail elderly patients, as well as a collaboration with Health Solutions, which is essentially a risk management arm within our organization, learning to take care of populations. That coupled with a clinical call center where we have integrated nurses into our 911 center, as well as a collaboration with hospice now. And really initially it was about learning how do we do this safely. Can we get good results in terms of patient satisfaction? Is it clinically safe? And can we achieve the aims of really the IHI, which is to improve health of populations, improve satisfaction for our patients and the care we provide, as well as lower the cost of health care. So that's what founded the program, and we've been doing it since 2013. But really, in 2016, the culmination of our work came together through an approach where we've been doing a bunch of research and collecting data about our program. And we were able to publish our results in a peer-reviewed journal with the Journal of the American Geriatric Society, where I believe we're the first in the country to show clinical outcomes associated with our community paramedic program. And we're very excited to have been able to publish, and we're looking to do a lot more in the future.
Awesome. What were some of those improvements in clinical outcomes?
Well, really, the question was, can we keep patients safely at home, or do we need to, move these patients to the ED? And the population, the initial pilot population, is a group of high utilizer patients that represent about 5% of the Medicare population, but also represent about 50% of the dollars that we spend in the United States from Medicare on health care. So really kind of low-hanging fruit. And these patients are not necessarily in hospice care, but they're in the last maybe 5 to 10 years of their life. They're high utilizer patients. And really it was about trying to figure out what could we do to help improve their care and more importantly, keep them out of the hospital. And could we do it safely, and were the patients happy with it? And we originally started as an off-hours program, so unfortunately healthcare sometimes still operates like a bank, and it's kind of Monday through Friday, 9 to 5, and during off hours, oftentimes physicians have no other choice but to send patients to the emergency room. So our idea behind it was looking at other innovators like Matt Zavatsky and some other early community paramedic programs, was could we find something in terms of repurposing our paramedics in the street and use them to achieve that aim of keeping patients safely at home, quite honestly what we found out where they desired to be, and do it so that it was clinically safe. And then again, also, were we able to actually show savings associated with this? And the results, happy to say, we only transport about 20% of the patient population that we go on in the study, compared to about a 95% transport rate in a traditional 911 setting. We had 0 clinical defects, meaning we had no clinical errors, no clinical concerns, no issues. And our recidivism rate or post-visit rate within 24 hours was less than 1% bounce back or transport to the ED, and after 48 hours it was less than 2%. Oh. So we believe we're onto something, and after we published the paper we started hearing from a lot of other community paramedic programs seeing very similar kinds of results in terms of the numbers, both in their bounce back rate as well as their transport rate. And in fact, some programs have been able to achieve lower transport rates because of being able to bring in additional componentry associated with certain medications like antibiotics, and the ability to do some additional skills we're not able to do right now in New York, like for example, changing Foley catheters, believe it or not. Patients go to the emergency room all the time because of a clogged catheter or an inability to get services, to have a catheter replaced, as well as feeding tubes. So We know we're onto something. There's a lot of groups out there that are onto something, and we were just very proud to be able to get our results out there for the world to see. And it definitely has been it took a village, and it was a team effort by many different folks involved. And so we're very lucky, and it's great to have been recognized for some of this work.
Well, congratulations. It's an amazing accomplishment to make all the positive change that you have in your community.
Great, thank you very much.
Thank you, Jonathan.
Yep,
it was
thanks,
a pleasure to
appreciate
see
it.
you again.
Thanks.
This is Ryan Kelly for the Journal of Emergency Medical Services, and I'm here with Jonathan Washko, who is one of the recipients of the EMS10 Awards for Innovations in EMS for 2016. Thank you, Jonathan.
Thank you.